Welcome to Transforming Medical Communications, a podcast by MedComms experts. We share medical communications insights and advice from the best and brightest in the industry to find out what they're doing to push our industry forward. Here's your host, Wesley Portegies.
Welcome to the Transforming Medical Communications podcast. I'm your host, Wesley Portegies, and joining me today is Anna Bozas. After completing her PhD in biochemistry, Anna has gone on to an impressive career in medical communications over the past 10 years. As a director of scientific publications at Ipsen, she oversees all aspects of scientific publications and medical communications for 3 rare disease therapies. Welcome to the show, Anna.
Thank you, Wesley. I'm delighted to be here. You have a great podcast series.
Thank you. So maybe to get into it would be nice to learn a little bit more about your background. Could you maybe take us back to the beginning of your journey in medical affairs, and what were maybe some kind of pivotal moments or experiences that steered you towards medical communications specifically?
Yeah, sure. So I started as a general background as PhD in biochemistry, so straight academic. And I graduated in the time of the Great Recession. And so it was a difficult time trying to do anything other than academia because everybody else was getting laid off and they had, impressive experience, and there wasn't something that I could compete of. So I took the time while still being in academia, thinking about what is it that I could do. I knew I wasn't going to stay in academia, mostly because for me, it was a work-life balance thing. I was doing 16-hour days in the lab, and so was my PI, and everybody else I knew. So that wasn't feasible if I wanted a family. So when I graduated, I thought about what is it that I can offer as skills. And the postdoc essentially, and the PhD, trains you to be a great communicator and trains you to be a great analyst. So I offer those 2 skills to the world. And I think the demand was for communication, not so much for analysis. So it's sometimes it's demand and supply and demand. That's what it was.
Yeah.
So I started as a medical writer for a consulting company. I spent there about almost 4 years. It was awesome. It was, to me, the variety of activities that I could do, the variety of clients, the colleagues who had completely different experience. This was in health economics and outcomes research, which was completely new to me. It was amazing. It was like a learning experience. And from there, I went into the industry, starting as a publications manager and then sort of just the regular upward trajectory, where now I'm director of publication MedComms. So pretty straightforward.
Yeah, exciting. Very exciting. Great. So since you have so much experience in this industry, how have you observed, some changes in our field of medical communications? Like compared with 10 years ago, how do you feel, specifically when we think about how healthcare professionals consume content? What are some changes that you have seen there?
So HCPs are humans too. So they have the professional part, they have the personal life, they have, busy lives. They have the cell phone in their pocket too. I was speaking to a friend of mine who is a healthcare practitioner, and she essentially told me that for every patient that they spend, 15 minutes face to face with, they spend an hour on paperwork, basically. So the administrative demands are higher than the actual patient caring part. So it's, their time is being decreasingly and shortening, and their attention span is pulled by 10,000 other different things. And they all live in the same world that we live in, where you get blitzes of information that come at you from 1,000 directions. So, you have to get to consume a lot of information fast.
Yeah. So let me kind of recap what I hear you saying. I think what I hear you saying is HCPs are just humans like us. And when they change their behavior in their personal life, like the accessibility of the internet, smartphones, and so on, maybe they're surfing on Instagram during their time off, obviously that is not that compartmentalized from their professional life, just like us, right?
Yes.
That is kind of one thing I heard there. And the other thing I heard is because of all of that and because of all the additional channels and because of the increased burden of administration, for instance, for healthcare professionals, they have less and less time to spend on actually consuming content.
I totally want to say that. Absolutely. Yeah.
So how do we deal with that, Anna? What are some things that we can do as an industry to deal with that? Like, how should we
Yeah.
adapt?
So from my side, number one is sort of having the signal rise above the noise. Okay. So I have, things that I want to put in front of the public, including, or maybe mainly HCPs. And I need them to pay attention. And having that, old Gutenberg press type of stuff is not enough. It's to read a paper, to read a scientific paper deeply. It takes hour and a half. Nobody has that kind of time. Okay. We need to have them view the material, understand the material in not even a matter of minutes. It used to be like a 10-minute video was considered short, Now it's like 30 seconds, maybe a minute. When you get to 3 minutes, people are gone, So to have material that can be consumed fast or at least previewed fast and saved for later review. So, this is number one thing. Be out there, be visible, and then be biteable, snackable, short.
Yeah. So the content needs to adapt to busy people that don't have much time and give them the opportunity to delve deeper if they need to. Is
That's
that what
right.
you're saying? Yeah.
Yes.
Yeah. I fully subscribe to the same opinion as you. And there's a lot of research out there, right? That both about the attention span and generally also when you look at like how the world evolves, like everyone is kind of into short form content. Like most content like YouTube Shorts or Instagram or TikTok or all these things, it's all short form and we're getting used to that as humans, right? So I think it makes total sense that we need to go there, but it is difficult because we communicate science, right? And we want to be comprehensive and communicate it all. So
be accurate.
And be accurate at the same time and don't introduce bias or, be cherry picking about our data. So what are some ways to be more concise? So how do you feel MedComms as a function could better prioritize their data so that it can be presented in a more short form?
Yeah. So this has always been a challenge, right? The number one is this stuff. Do you lose accuracy when you're trying to be short? The biggest issue for our industry is that we're highly regulated for good reason because we impact patients' lives. So ultimately, this is material that will affect a human life. So we must do no harm just as much as physicians must not. And you don't want to have information be too simplistic to the point of it loses the meaning. But you can't have all the details because people don't want to face a tsunami of information. It's like that problem with you have 15 ice creams and you can't decide which flavor you want. But if you get vanilla or chocolate, you can make a choice, So it's sort of the same approach. Give people first the choice and then sort of guide them into the material as based on their time. How deep do they want to go inside? How much information? So for me, for example, the kind of material that works best for me personally is an infographic. So an infographic abstract. Instead of having the whole paper, what are the main highlights? But so when I think of infographic, it's like you want to give it like the title, the authors, maybe the traditional scientific abstract, and then smack down right after that the infographic. That's what I consume the best. There are people who like podcasts, and for them it's more convenient most of the time, usually because they have a long commute or they're like doing something with their hands, but their brain is available. So there's a practicality. Or maybe they're just, how do you call audio learners or sound auditory learners, whatever. I can't handle data without a graph, for example. You can tell me this, we had an increase in whatever or whatever, a better, whatever. I'm like, show me the graph. So I'm a visual person. But yes, trying to have things that can work with people's lives, that makes their life easier while getting the information. So auditory stuff for auditory learners, visual stuff for visual learners, navigable videos. It could be a video, but you could navigate to the part that you really want. So if you're thinking about, let's say, a drug, you could have mechanism of action, you could have safety, you could have efficacy, and maybe you could have implications for the field. And maybe, people who are familiar with mechanism of action, they want to skip it and go straight to efficacy. Or they're worried about some side effects, go straight to the safety profile. So, that's another example.
What I like about what you just said is kind of the underlying context that I'm hearing from you is like put the audience in control of the content in a way, right? So we provide it all, but we provide it in a way where they can choose like how deeply do I want to delve into it? And we also put them in control of which parts they actually want to know more about. Like what you just said, actually, that really is something that I think is currently underutilized, even in videos or those kind of things where you can easily... The technology is, of course, there. That's easy. But are we really using the technology yet to do that? Like maybe not so much, right? But I think the concept of putting users or audiences in control of the content is a great way of working. And the other thing that I heard you say is basically around people are different and they have different content consumption preferences. So we should like let go of the singular thinking when we talk about formats. And we met at the ISMAP Academy last year, right? And
yes,
where we were talking about that. And I think for the industry, this is kind of a mindset shift that needs to happen, or especially in publications, right? Because I often get this question, like we're experts in publication extenders. And I often get this question, well, Wesley, like what format would work best for this? And it's like, well, there's no one format that works best because it depends on who your audience is. And your audience is by definition not going to be like a homogenic audience. Like there might be an HCP that wants to hear this while doing a workout in the gym, someone else behind the computer in their office, and someone else might actually want to see it on social media. And this is a super quick 5-second thing.
Right.
So this is the onset of omnichannel, obviously, that we're heading into in terms of our discussion, where, the different channels and formats need to be available for your audience. Yeah. Any experiences? I understand you can maybe not go into detail on anything, but like more generically, any experiences that you could share on using different content formats and what maybe the impact of that was or the output?
Yeah. So the number one barrier to doing multiple content formats is usually a budget, because for everything that you do, there's a cost. And usually you get this question whenever you're trying to, make any kind of enhanced digital content. Well, why are we doing 5 different things? We're saying the same thing. Let's just choose the best one and use that one. And I have to have exactly that conversation with the different ways of digesting these different people, different audiences, and so on. That being said, we do try to offer at least 2 or 3 different ways of consuming something. For example, a video, you can look at it or you can just listen to it. So it's a video and podcast all in one. You can squeeze into it, depending on how much time and energy you have, a QR code for extra material that is just not visual. I mean, just only visual, not verbal. So I try to squeeze as much as possible. I think the lowest hanging fruit for us has always been that infographic thing, because it's usually the cheapest and sort of the biggest bang. The reason I say the biggest bang is because there were a couple of posters, maybe 3 or 4, from different groups at ISMAP over the years, looking at how these things are consumed. And as you were saying, and as I was saying too, for that matter, it's not always the same people, but you don't have 90% preference. What you have is 50% for a group, 40% for another group, 30% for another group, and there's overlap. And I don't think I've seen anywhere something like 60%. 50 is as good as you can get. And infographics were always in the top 3. So sometimes it was the podcast that won, sometimes it was the movie that won, sometimes it was the infographic, but it was never at the bottom. So I'm like, cheap, and if you're in the top 3, you're good. So again, also personal preference, right? But yeah, so we've tried to offer these 3 things for sure. There are other colleagues that I've seen who offer interactive posters. I've seen generally. And for them, I think the payout is not just for the user going where they need to do, but for them being able to track the interest of the user and make more targeted materials the next time. So it's like a 2-way street there. We haven't gotten that far because it's, for us, a more complex type of project. So complexity has to be considered to, how much time do I have? How familiar am I with it? How familiar is everybody else I need permission from with it? Because I have to now convince them and so on.
Yeah, that makes total sense. I liked what you said around like the QR code in the video, because more as a general concept, I think we are designed in medical affairs a little bit as silos, right? By definition, like we have our MedComms department, MedEd, we have our field medical department, right? And a few more. And by definition, they kind of do their own thing generally, right? While if you think about this, like it should be a more coherent collaboration on content. Like what is really needed in the market and why? What are the educational objectives and how can we tackle those? And how can we make sure we are like one voice as an organization? And by what you just said, like this is basically connecting those different functions and different channels, right? Like in a way, every function owns a kind of channel, like how field medical owns the channel of MSLs talking to the HCPs, right? And it's really important that we start linking those different channels to each other. So this could be as simple as the QR code in the video that you mentioned. It could also be an MSL that's now sends a follow-up material after a conversation that was actually developed by MedComms and is maybe on an educational portal somewhere, rather than the touch points always being the same. Like next touch point is the next MSL visit. It doesn't have to be. We now can think in this more omni-channel approach where we can link the different things. So I'm really excited about that movement, and I'm starting to see this in the market with some companies, advancing in this space. So let's circle back to those podcasts that you mentioned before. You said that, like you kind of like the format, but if there is data and charts and so on, then it might not be that handy. But in the latest study that came across my desk, I saw that 72% of HCPs actually have a demand for podcasts. From what I see in the market, only a small percentage of pharma companies are producing them. So what is your feel on that?
Yeah, so I think that would be a great opportunity for pharma to do more podcasts. I do think that HCPs are the, busy traditional worker who goes to the office, and we have that whole commute time when it's opportune to listen to a podcast. This is what they're, the ideal mode of consumption for the podcast. I also think that podcasts are great for when you're looking for opinions. When you have a consensus on something, that's great, but there is always some sort of gray area of interpretation of something. And that's the opportunity to have the debate and, learn from individual practice or learn from what are the dilemmas, how to move forward. And these are absolutely ideal for podcasts. These are also really wanted by clinicians because they don't know everything. They'll never know everything. Even if they spend 60 years in something changes. So they love to see, well, I'm doing the X, but what are you doing? Is it the same X? Is it a Y? Is it better? Maybe it might improve some of my stuff. Is it something I haven't thought of? So it's definitely something that we should do more of. And it's also, because it involves people and their opinions, very interactive. People get invested. It's like you get collaborations and the future life outside that initial podcast. So I'm very much a proponent.
Yeah. So in other words, like it's a great tool. You just need to know what to use it for, right? Like trying to explain a complex mechanism of action through a podcast would probably not be the best idea, right? But when it comes to more like discussion and, like points of view from healthcare professionals,
Yes.
for instance, it could be really, really interesting. And I really like that. So, and this is, this comes a little bit back to the singular thinking we were talking about, right? Like we're kind of used to create summaries of publications. And we apply that often a little bit generically to what we're doing.
Yeah.
So every format is a summary of the same publication.
Or a lab report, essentially.
Yeah. So we can maybe become a little bit more creative, of course, while staying within all the compliance boundaries and making sure we communicate accurately and comprehensively and don't introduce bias. But like, I really like this way of thinking. And I've been thinking for a long time that we could think more around like the educational themes that we have around our particular therapy and focus on that, and then think about like, well, around this theme, we want to have discussion about that. That could be a podcast. We want to communicate more like the hard data like this, which could be the infographic. We would like to explain how the drug interacts. Well, we are going to build a short animation. All of those assets are related to the same overall objective and communications objectives, but they serve a different purpose. And now they become interlinked as well. So, and this is how I personally look at like what omnichannel really is. Like, I don't know, like when we ask two people what omnichannel is, we get like 6 different answers, but that's my answer. Yeah. So how would you describe omnichannel?
So I will tell you how I want to describe omnichannel, which is the first time I heard of it. I was asking somebody in the audience, what is omnichannel? Because they're talking on a panel, and I'm like, I don't want to look stupid. And they're like, well, that's something commercial does. And I'm like, okay, so no, omnichannel is not something that commercial does. Okay, it could be something that commercial does too, of course. But omnichannel is really trying to follow the interests of the users and feed it the data or information that it wants.
Yeah, I like that.
So the traditional omnichannel example that I'm thinking of is Amazon when you're shopping. So you're going on Amazon, and I started a long time ago, like 10 or whatever plus years when they first launched, and you're looking for a book. And Amazon will see people who read this book also like yellow shoes. So your interest and your information transitions naturally to other things that you would like or are interested in. And of course, there's, data mining involved in this and, the following your interests and so on. But it's for a good purpose. It's giving you the stuff that you need. It's filtering out the stuff that you're not so interested about, for good or for bad.
Yeah, that makes sense. So, and how about your view on the different medical affairs functions involved in all of this, right? Like I said before, we're a little bit siloed, right? Like MedInfo, MedComms, publications, which can be sometimes completely separate. How do you feel we can align better within those different functions so that we have a more comprehensive and consistent communication model?
So the first thing is to align strategically. The biggest difficulty that I see from my function is we're all locked into execute mode. We have to deliver this, this, and this, that we don't take the time to think about why are we doing this? Who is receiving what we want them to receive or not receiving it? Okay. Why they're receiving or not receiving, and how can we make sure that what we give is of use to them? Because everybody has an agenda, but the stuff that works best is always the stuff that where you have a win-win. You win because you say your story, but the recipient wins because they want to hear your story. You don't win when you put your story out, people listen, and they're like, oh my God, they spammed me. Okay. So the way to work internally is first to discuss a line. Usually we do it once a year and discuss what do we want to say, what's important to us, right? And then is the field equally interested in this? And if not, why don't we have the stuff that the field wants to hear about? Or how is the stuff that the field hears about, influencing what we're going to do? Once that conversation happens and from both sides what is wanted and what we have kind of thing and what we want to say, then it's a lot easier to execute because then it's just a matter of, going from place A to place B. It's not how I'm getting there. It's more like, let's deliver.
Yeah, that makes sense. How would you know what the field wants, the market wants, or the HCPs need?
So there are many, many ways of doing this, and everybody has their own ways of collecting information. I am old fashioned. I will literally ask the HCPs that I work with, and usually I do it once a year. What have you found going to congresses? What did you like? What didn't you like? In the pandemic, especially because we didn't have a choice, we had to go virtual. We were questioning whether or not we should even present abstracts and posters anymore. And I asked my KOLs because there's a huge time investment to produce them. Do you want to do them? When you go into virtual congress, do you look at a poster? Is it of interest to you? And they said, typically, not so much. Not so much. What they went in the pandemic online for the congresses, it was the big congresses where they could choose a particular session to listen to, or the debates, the opinion giving parts. Everything else, not so much of interest. They would have preferred the in-person interaction to a small congress, talk to the colleagues face to face. That's when they're in front of a poster. This is just one example. But if you don't have that feedback, you don't know what you're doing and you don't know where you're putting your money on. So I do that pretty often. Other people, like I said, they do this interactive content and they collect information through the content. So if you do 5 different ways of putting your information out there, you do the video, you do the podcast, you do the interactive poster, you do whatever. And then you look who clicked, how many seconds they stayed on it, which section they viewed, from which page they came, whatever. And that's one way of collecting information. For me, that's low-hanging fruit, but not enough. I need to hear the person talk too.
Yeah, you want some context around those numbers. Yeah, I get that. Like, I do like the idea of, the power of scale behind that, right? Like if you so I call that content performance metrics.
Yes.
And actually, I just had a manuscript accepted by Current Medical Research and Opinion, which should come out like anytime soon, hopefully next month or so.
Congrats.
Thank you, around publication metrics. So we're looking at journal level, article level, but then actually at extender level. And we're actually getting into like, okay, what are content performance metrics, and how can you use that to inform your strategy, right? So I am a big fan of it, but I also realized that, you need some context because you don't always know why something is what it is. And the kind of color that you need around the data to understand it is similar as when we present data to our HCPs, right? They need the context around it too. So that makes total sense to me. But it's really exciting that we now get these opportunities with all the online platforms and technologies that we have to communicate, to start actually understanding like what is the value of that we're doing here, like what kind of content is consumed most and why. And I think that should really be a driving factor in the work that we do, so that we can optimize like the educational effort that we're doing.
And it's also very useful because, when you interview people face to face, you get the context, but you can't do 100 people, right? So you get N more than 5, basically. The actual statistical power.
Yes.
Of what a diverse target audience would react to, as opposed to my 5 best friends who all have kind of similar favorite whatever activities.
Yeah, exactly like that. Or an ad board, right? Like where we have a bunch of KOLs, but like they're the KOLs. So do they really know like what the rest of the market really needs and understands or doesn't understand, and so on. So I think, this is really filling like a big gap that we have had before. Now, are we there? Probably not. Like I haven't really seen many companies yet that have like a proper metrics, content performance metrics framework in place, but we're close to there. With the onset of omnichannel and connecting all these different deliverables together, I think we're very close or on the brink of having access to things like that. So Anna, what else do you think companies should really be doing right now to challenge the status quo in medical communications?
So I do think we should be more digital savvy. And it's surprising, we're at a time when ChatGPT is doing everything. It's already taking over your computer, in case you didn't notice. You already have Copilot. And if you're not using it, you're going to be surprised. Okay. And yet, this kind of stuff, extenders that we're talking about to the digital audience, this is stuff that we talked about 10 years ago. So we're like, I know we are a very conservative industry in pharma, but 10 years behind is pretty conservative, So it's time for us to sort of push the boundaries and move a little faster. If not, everybody else will move fast. It's my kids are already on the smartphones and they're already talking to ChatGPT, okay? They're already interacting this way. There was issue in JAMA, I think it was last year. So ChatGPT came 2 Novembers ago. The issue in JAMA, I think, was April. So let's say 6 months later, no, maybe less than 6 months. I'm terrible with time, but let's roughly say 6 months. And in that issue, they had comparison about how doctors performed against ChatGPT, against questions posed by patients on social media. So a patient would say something, for example, I swallowed a toothpick. What do I do now? Okay. And then you have the answer from ChatGPT and the answer from the doctor. And the interesting part was 70% of the patients prefer the robot. And you're like, how could they prefer the robot? It's like raw and finished. It was a new technology. Why would they pick ChatGPT? And the reason, if you look, you had to actually read the whole paper because it doesn't come, as a summary. The reason they did is if you look the answer, the doctor is responding something like, well, it's 24 hours later. If you haven't died yet, you're not gonna. So you're fine. That's a typical doctor response. They've seen thousands of patients. They know the patient is fine. ChatGPT would be something like, well, a toothpick is made of wood. Wood is a biodegradable substance. It will go through your system. It's more likely going to pass. If you is seeing massive blood, then call ER, but otherwise you're probably fine. So you gave a lot more context and it sounded more reassuring.
Yeah.
And this is what's happening now. These tools are already used. They have been used already now for a year.
Yeah, so I agree. Like being more digital savvy is definitely a thing. And even now, if you look at, pretty straightforward things like using social media in our industry, we're still talking about it, right? Like, can we do that? So yeah, especially as someone who entered this industry with the idea to innovate, and I subscribe to the same thinking. I understand it takes time. I also understand why it takes time. But I also know that if we put our heads together, we can absolutely accelerate how we are going about these things and how we can communicate more and better.
And I think the mindset to this, Wesley, is how would I want to consume the information? We're all patients in real life. All of us have some disease or another. It's impossible to not be sick at some point in time. Okay. How do I want to consume information? When do I have time? I have husband, kids, job, dog, cat, whatever, and I need to consume information. And I'm, you could say, how do you call it, the expert in the field. And it's still, I don't have the 1 hour to consume it, right? And then how would everybody else want to consume it? How would the medical professional want to consume it? How would the patient want to consume it? We have to have that first before we do anything, before we write anything, before we put anything out. That's the first question. How would I consume it?
Yeah, that is true. And I think there are two aspects to that. Like, one is if we have a certain opinion about that, it's probably true for our audience too. And the other thing is that I think it is actually very hard to place yourself in the shoes of your audience, right? Like, especially in our industry. Like, if you think about it, like if you work in pharma, you know everything about your product. Everything every day is about your product and the science behind it. But if you're an HCP, it is not all about your product, right? It's like it's a part, and likely a small part of their professional life is about your product and the science behind it. And a much bigger part, the 95%, is about all the other things, about like seeing their patients, all the admin that comes with being an HCP, all the other things that need to happen. And sometimes it feels little bit like, because we are so excited about our science, we make the assumption that everyone is going to be as excited and has all the time to engage with it. And that is simply not the reality. Mm-hmm. So like really looking at it through that lens, I think also really helps. It's like, okay, I have 5 minutes today to quickly learn about something here, and I just need to know what I need to know to help my next patient. That is kind of what I'm looking for. Puts a completely different aspect to how we create content and how we design it and how we design it for consumption. And there's like an interesting concept in what they call visual language. It's called heuristic scanning. And it basically means that like there's a certain way how people engage with content, and they tend to scan something for like maximum 10 seconds, which is probably longer than it even is. The 10 seconds is not used to consume anything. It is just to assess. And it is like, is this relevant to me? Am I at the right place? And do I trust this? And if those three factors are fulfilled, they might read more, right? So like we need to start designing our content with that in mind, rather than assuming that everyone is going to be interested, excited, and engaged with it all the time, because that is simply not the reality of life.
Yeah. And I also think we should apply some of the principle of the search engine optimization, because
absolutely,
or like, I hate to say this, tabloid headlines. I don't necessarily care about the lives of all these stars and all of these whatever celebrities, but the headline grabs you. So to be headline grabbers, but still compliant and still not exaggerating. So it's difficult, but it can be done, or we should at least try to do it.
Absolutely. I fully agree. So Anna, like time is flying, of course. This was a really great conversation. I have a last question for you. For anyone listening to this podcast working in medical communications, if you could give like one major tip, something you really care about and that you want to encourage people to do, what would it be?
Okay, so if I had to give them one sort of guiding principle or one thing to think about, for me is that reciprocity principle. How do I want to be treated? Right? So always give your best. Always have the best intention. Always look for simplifying somebody's life. Always have that person's interest first. And, don't be pushy, which is hard for me, by the way.
Well, it can be for a good reason, right? Like, and I think those two things are not mutually exclusive. Like being kind and compassionate to the people around you doesn't mean you cannot push the barrier, I think. And I really like that. And it's something I respect about you as well. I know you're someone who is also trying to move the industry forward with forward thinking. So it was a pleasure to have you on the show here, share your thinking and your insights with our colleagues in medical affairs and medical communications. So thanks so much, and I hope to talk to you soon again.
Thank you, Wesley. And I'm delighted again to have been invited here. It was an awesome conversation.
It was my pleasure.
Transforming Medical Communications is brought to you by MedComms Experts. To find out more about MedComms Experts and how we create some of the most cutting-edge medical communications programs anywhere in the world, visit www.medcoms-experts.com. And then make sure to search for Transforming Medical Communications in Apple Podcasts, Spotify, and Google Podcasts, or anywhere else podcasts are found. Make sure to click subscribe so you don't miss any future episodes. On behalf of the team here at MedComms Experts, thanks for listening.